If you feel like you've developed almost an anxiety about going out to eat or having dinner with friends or relatives, and you really just don't feel comfortable doing that because of how you feel and how much gas and bloating you get, please keep watching this video. One of the most common things I see in clinic is bloating or abdominal distension. And there are several different reasons why you may become bloated. A lot of people may think, oh, it's something I'm eating or I need a digestive enzyme, and that might be helpful. But I want to discuss some of the top reasons why you may become bloated. So one of the most common ones is food sensitivities, right, where we have a reaction to the food that produces gas within the abdomen. Another reason can be low stomach acid. Another reason could be lack of digestive enzymes, poor gallbladder health, bacterial overgrowth, candida or yeast overgrowth, parasitic overgrowth, lack of beneficial flora in the gut. There are many different reasons why we can get bloated. One common scenario I see is you wake up in the morning and you have very little bloating. The abdomen's nice and flat, no gas, no abdominal pain. And then we eat breakfast and maybe you feel a little bit, but not too bad. Maybe have a snack in between breakfast and lunch, still not too bad. You eat lunch and now you're starting to feel some bloating come on, maybe some abdominal pain, maybe some gas, and then have a snack after that, or maybe dinner. But at dinner time is typically where a lot of people feel really uncomfortable. It may be the biggest meal of the day, but also it's an accumulation of everything that we've eaten throughout the day and all the stress that we've incurred throughout the day. So if you eat, right, you have to have good stomach acid, good pancreatic enzyme function where your pancreas makes these enzymes and pushes them into the gut to help you break down the food so we don't get things like food sensitivities and react to these food proteins. We have to have really good gallbladder function to push bile into the small intestine to help you break down those fats. And then we have to have good motility to get it down into the colon. We absorb everything in the small intestine, but in the colon is where we have the microbiome. That's where we have the bacteria and the yeast and the parasites and the good beneficial flora. It's okay to have a little bit of the other bugs like opportunistic bacteria, yeast, candida, parasites, but it's when we get the overgrowth of these bugs that we have a problem. And that's one of the most common presentations I see is that the bloating slowly accumulates throughout the day and it gets really uncomfortable after dinner.
So if I have food sensitivities, Dr. Paul, can that cause my bloating?
Food sensitivities can certainly cause bloating. One of the mechanisms can be your immune system obviously reacting to the food, but how it gets there is typically that we don't break down the food enough, and then these food proteins are undigested, and then that can feed different bugs in the gut. We can have immune reactions to these foods, and then bloating can be as a result.
What about bloating in terms of an allergic reaction? So if I'm allergic to foods or ingredients, could that cause my bloating?
An allergy to food can certainly cause bloating as well, but food allergies are defined as a reaction within a 3-hour exposure, and these are usually IgE mechanisms where you think of, oh, someone has a peanut allergy and they need an EpiPen, or someone has seasonal allergies and they have, scratchy throat, irritated eyes, they're sneezing, that kind of stuff. And you can also get more localized IgE responses, but you think of like the swelling, and with swelling, sure, maybe you could get a little bloated. But a lot of times we can get it from things like low stomach acid as well, low pancreatic enzyme output, not breaking down those foods enough. Poor gallbladder function, we're not pushing that bile out and emulsifying and breaking down that food. We can get it from bacterial overgrowth, right? Where we're eating foods like maybe higher carbohydrates or things that break it down into sugar, and they feed things like bacteria and yeast and parasites. And these bugs in the gut, they love that. And what they do is they gobble up that food and then they make gas, right? And that gas will distend your abdomen, give you abdominal pain, give you some maybe diarrhea, maybe constipation, uncomfortable gas, those kind of symptoms that can be really uncomfortable.
What are some of the most common things people eat that seem to cause bloating in your experience?
The most common things that I see cause bloating are high carbohydrate processed foods and anything that breaks down into sugar. Obviously, gluten is a big one. Certain other grains can be big. Dairy, if we have sensitivities to that, any other foods that we have sensitivities to. But the high sugar carbohydrate foods or the high FODMAP foods, they can feed the bugs in the gut what they want. And then as a result, they can produce that gas and then produce the bloating. I see patients like this every single week in my practice, and they try to do things on their own, but they just can't figure out what is causing their bloating. In a vast majority of the cases, functional medicine can help with bloating. The ways that we help with bloating is first, we have to figure out why you're bloated. And that means test, don't guess. Find out, is it coming from food sensitivities? Is it coming from low stomach acid? Is it coming from low digestive enzyme output? Is it coming from things like poor gallbladder health? Maybe overgrowth of bacteria, overgrowth of yeast and candida or other fungal infections. Maybe overgrowth of parasites, lack of beneficial flora, chronic stress, poor motility, right? There's all these different reasons that can give you the bloating symptom. And we want to test and figure out why. Once we get this information, then we meet up and we go over the test results and develop a personalized, individualized plan for you. With functional medicine, we have a very high success rate with bloating, and you do not have to put up with this the rest of your life. You want to find out why. Always ask the question why and test and figure out why you're bloated. That is when you get to the root cause of the problem.
I've had bloating for the past 3 years. How soon am I going to get better?
How significant are the findings, right? If we have, hey, it's all coming from food, or maybe the next person it's, we have bacterial overgrowth, we have yeast overgrowth, we have parasite overgrowth, looks like we have low stomach acid, we have a lot of inflammation in the gut, and we have food sensitivities, that's going to take longer because we have more work to do. So there's a lot of different factors when it comes into expectations, but that's why you test and not guess, and combine the history with the test results to develop better expectations and more, more consistency, more laser focus in terms of the protocol versus just guessing on what diet might be good or, hey, try this supplement like you see all the time. I typically like to have my patients see improvements within the first 3 months. That does not mean 100% better. That means signs of moving in the right direction. I like to see my patients hit goals around the 6-month mark. Again, everybody is different, but overall, we have a high success rate with bloating in our clinic, and it's just trying to test and not guess and try to figure out why you're bloated.
I've visited my MD and I've done testing and all my tests are negative, but I still have bloating. Why do you think that is?
Mhm. A very common presentation I see is they've done pretty much everything that traditional medicine has to offer in terms of, endoscopy, colonoscopy, CT scan, MRI, X-rays, whether it's breath tests, ultrasounds. They've kind of gone through the gamut with that, ruled out celiac disease, maybe a few food allergies, maybe lactose intolerance or fructose malabsorption. They've done a lot of things like that. But at the end of the day, they're like, I'm still bloated. So if everything's negative, why am I still bloated? They're looking at a lot of stuff through a picture or through a camera lens, right? An MRI, right? It's essentially a picture, right? Camera lens, right? They're looking through a scope, endoscopy, colonoscopy. And they're looking, for the most part, they can zoom in on stuff, but it's not underneath the microscope on most of the tests. And that's where we look at the microscopic at the cellular level to try to understand what's driving the bloating, right? Bloating is just, a symptom, distension. It's a symptom of something that's upstream, right? You have a problem upstream that's causing the symptom downstream. And we have to go upstream and try to figure out what's the root cause, what is driving the bloating. Sure, some people can take digestive enzymes and say, hey, that helps. But the question is, well, why do we need enzymes? Why isn't the pancreas making the enzymes? We always want to go upstream and figure out what is the problem driving the downstream symptom.